Hi, this is Mike from skillofstrength.com. Here is our lower body foam rolling circuit. What we're going to cover today is basic foam rolling techniques for the lower body. I'm going to try to do it pretty simply and pretty quickly just so you can have a good comprehensive way to put this whole foam roller circuit together. Stay tuned for our next video, which is going to cover some upper body foam rolling. First one we're going to start with is our calf. So I'm going to work on my right calf here. And we're just going to place the foam roller right into the belly of the calf. You want to make sure that you don't tighten up the muscle there. Keep it nice and loose. I like to point my toe when I'm doing these. So I'll just start. I'm going to use my hands and my foot to take a little bit of pressure off in case it's too sensitive. So I'm just going to roll the belly of that calf 10 or 15 out. Just try to stay relaxed. If you find that the foam rolling is too aggressive, then take a little bit of pressure off with your feet and your hands. I'm also going to make sure that I rotate in and get the medial part of my calf, as well as rotating out and getting the lateral part of my calf. And again, chase the areas that are a little bit tender and have the trigger points, and then go from there. Usually about 15 rolls per area will suffice. From there, we're going to move right up and get the belly of the hamstring. I'm going to start slightly right behind the kneecap, slightly higher, and I'm going to just roll the hamstring out. This shouldn't be too tender, but if it is, again, you can always back off a little bit. And the same principle will go. I'm going to rotate my leg in and work the medial part of the hamstring, and the same thing, work the lateral part of the hamstring. Okay, from there, I'm going to go right up and hit the glutes. Now I'm working my right side, so what I'm going to do here is I'm going to take my right heel and I'm going to put it on my left knee. From here we're going to just roll the piriformis out a little bit. And again, I'm going to roll back and forth. And you can kind of change the angles on these a little bit. Try to roll maybe a little bit towards the outside of the hip or a little bit more towards the inside. Again, move around so you can find the angle that works best for you. Again, I'm just going to kind of chase the areas that are a little bit more tender. From here, I'm going to kind of work right up where the IT band inserts, which is right up below the iliac crest. Now this is a little bit tough to find at first. Basically what you're going to find is that hip bone that's going to stick out, protrude, and then right underneath that is where you're going to start foam rolling. So, again, I'm going to try to find that area right at the top. And what I'm going to do on this to help is I'm going to bend the bottom leg in slightly, and then I'm just going to roll back and forth. This is always a tender area for a lot of people, so again, don't be too aggressive. About 10 to 15 rolls again in that area. Now I'm going to work the TFL. The TFL is that sort of problem muscle, as I like to call it. It's really hard to stretch, but here's a great way you can do soft tissue. If you don't know where the TFL is, find your ASIS, that bone that protrudes on the front. You're going to go about an inch down, maybe 2 inches down, and then an inch to the outside, maybe 2 inches to the outside and get that TFL. So I'm going to change my position. I'm going to drop down a little bit, and again, work that TFL. It'll also help if you move that right knee up. So you actually have to flex the hip slightly and go from there. From there, I'm just going to work the IT band. The IT band's going to run from the iliac crest all the way down to the lateral aspect of the knee. Two ways you can do this. I'll give you the intermediate variation, which is you're going to use the opposing leg to support, and you're just going to roll the length of the IT band. Again, you want to make sure if it's too aggressive, back off a little bit. Here's a little bit more advanced technique is when you can double stack your legs and go up and down. And again, this will really get in there. And again, you want to change the angles ever so slightly. You will get a little bit of quad here, but that's okay. Just make sure you're getting the whole length of the IT band. Alrighty. Now, from there, we're going to hit the quad. And again, I'm going to focus on the right side here. The foam roller is actually going to be to the outside of the right side of my body, rather. So I'm just going to work on, again, rolling the length of the quad. Try to relax the quad when you do this. And again, you can change the angles. You can toe out. If you toe out, it's going to work the VMO a little bit. toe in. That's going to get a little bit of the IT band in the lateral part of the quad. Now from there, I'm going to actually go right into a groin or adductor soft tissue work. So I'm going to position the foam roller, not vertical, but if you're looking at a clock at about 2 o'clock, you're going to point your toe away and down. You're going to roll all the way up into the inside of the groin. Now, guys and girls are going to have to use a different technique when they do this, just for obvious reasons, but you want to make sure you don't roll over things you shouldn't be foam rolling. Work the whole part of the groin. You can roll all the way to the VMO, which is always pretty tender. So try these basic techniques. Again, if something is super aggressive and hurts, you want to back off a little bit, because if you get to the point where you're foam rolling and it actually hurts and you're splinting that muscle and you're actually kicking the foam roll out of there, then it's probably too aggressive for you. So try doing this whole foam roller series before you train and see how it works. Enjoy.